How are you going, mama? It is now week 10 of your pregnancy. Now, over the last 10 weeks, your baby has been doing some extraordinary growing. It's actually currently about the size of a strawberry. But gear up, because as you start to near the end of your first trimester, your baby's actually going to double in size over the next 2 weeks. Now, if you were to have a 3D scan this week or see inside your belly into your baby, you would see some pretty amazing things. You would be able to see its spinal cord as it has translucent skin. You would notice that it was opening and closing its mouth. What your baby is actually doing is swallowing some of the fluid around it in order to receive the nutrients that it needs. This means that some of its vital organs, such as its liver, brain, and kidneys, are already functioning. You would also notice that it's got tiny little hairs sprouting up all over your baby's body, and you would see little fingernails and little toenails starting to grow. Now, your baby is able to produce urine from its liver, and it's also secreting digestive fluids from its stomach. If you have a boy, your little boy is already able to produce testosterone as early as week 10. Pretty amazing, isn't it? Now, your baby's limbs can also bend. So you would notice your baby's wrists bending to place its hand over its heart, and it would be exploring and touching different parts of its body with its little feet. You may feel a little bit rounded this week, which is perfectly normal, and you might also have the normal symptoms that you've been having so far. If you've been experiencing morning sickness, this may still be there, as well as fuller, swollen boobs. But it's around week 10 that a number of women start to report a few different symptoms, and we're going to list them for you here today. So you may notice that you're a little bit constipated. This is completely normal. Just make sure that you keep your fluids up and eat really rich fiber foods such as cereal, healthy cereals, fruit, vegetables, and dried fruit. A prune here and there never really goes astray. You might also notice that you've got some crisscross blue veins across your chest and your abdominal area. This is also really normal. They're known as visible veins, and this is due to the increase in blood production and blood flow to your body from being pregnant. They will possibly become more and more prominent as your pregnancy goes on. Another thing that you might notice is a thing called leukorrhea or leukorrhea, depending where you live and how you pronounce it. This is actually a clear and odorless discharge from your vagina. It sounds gross. Please don't be grossed out. It's completely normal. It just helps your body to cleanse your system better while you are pregnant. You might also be experiencing some pains in your hips, maybe even your ankles, but definitely around your hips and abdominal area. This is called round ligament pain. So when you're pregnant, your body actually produces a hormone to help your ligaments become a little bit more stretchy. This helps your body to shift and move and grow as your baby grows, and it also helps the different parts of your body to move as you are delivering your baby. I noticed around this time that I got a little bit clumsy because my ligaments felt a little bit weaker due to the stretchy hormone that was being produced by my body during my pregnancy. Now, some things that you might like to consider doing this week is keep up your exercise. It's really important that you stay healthy. So if you can, go for a gentle walk. Try and do at least 10,000 steps a day if that is possible. You might also like to look into seeing if you would like to have a CVS or a chronic villus sampling. What this is a scan or a testing for genetic and chromosomal conditions within your babies. Some people opt for it, some people don't, so it's something that you might like to consider doing this week. The other thing that is really important for you to do is to start making a list of baby essentials, and if you can, actually go out and buying them. That makes sense. It's much easier for you to spread that out over the next 7 months rather than waiting for up until 2 weeks before your baby's born and rushing out and trying to do everything at once. It's also much easier on your budget and your hip pocket. Once again, ladies, we are so excited to be here with you on this journey. So please make sure before you hop off that you leave a question or a comment about your journey with us here at Ready Set Mum, and we look forward to seeing you next week for week 11 of your pregnancy. I'm hiding from my kids, but before you go, do you love this video? And did you want more great pregnancy information delivered directly to you? If so, make sure you just drop by and subscribe to Ready Set Mum using the links below. Good luck.